All right, good to go. Um, Welcome to the vNova Checkup. I'm your MP for vNova, Chris D'Entremont, and thank you for this special Monday afternoon, Monday evening edition of the Checkup. And joining me today is Dr. Rob Strang. Dr. Strang, welcome to the Checkup.
Thanks, Chris. Thanks for having me on.
Well, just, first things first. I mean, we get to see a lot of Rob Strang sitting next to the premier and talking about numbers and epidemiology and a whole bunch of things like that. But just personally, how you making out? I mean, everybody we've been asking lately of, how are people feeling and, how's their mental state? And, lockdown's tough. COVID's been tough. So just how you been doing personally?
No, thanks for asking. First of all, I think that's important that we check in on each other. So thank you. I'm doing okay. And there's no, I won't pull any punches. This has been very hard. And the last couple of weeks have probably been the hardest for me throughout the whole pandemic. But I work with wonderful people. We kind of support each other, vent off camera and stuff. And then I have very supportive wife and kids, and then we get a lot. My family's getting a ton of support from our community and our church, right? So it's and I get lots of reach outs from people, and all of those I just I just tell people when I get a chance how much they mean and how strengthening getting all those supportive messages are.
Yeah, no, and I hope that a lot of people are doing the same thing, even though we do see on Facebook sometimes the discussion gets a little heated at times. But, I think just checking up on people, making sure that they have what they need, especially during these times of lockdown, is very important.
Yeah, I spoke to that a bit today about our mental health challenges and that we need to keep looking after each other. But I said it's okay to say that you're not okay and that you need some help and that we need to just be reaching out and giving each other support. That goes a long way.
Yeah, no, and I know that, people wait for those briefings to hear what's going on. I know I have a cousin, Darla, so say hello to my cousin, Darla, who thinks you're great.
Hi, Darla. How are you?
There you go. Hopefully I'll get a vote out of her next time. Let's talk about numbers today because, we've been watching, the third wave, this variant run across the province, really take it by storm. To we had a maximum of 224 cases a few days ago, down to 121. So can you tell us about the numbers and what you think that indicates?
So we're still in the thick of things. I think it's important that people understand that there's no quick and easy way out of this. But I am seeing the numbers today. Some of the other things that we look at internally, beginning to see some signs of progress that we're perhaps starting to turn that corner. And it's a bit of an ocean liner, right? You don't turn it fast, but I think we are starting to, which is what I expected to see. I knew Nova Scotians would respond. We're now, tomorrow will be 2 weeks into those restrictions, and it takes 2 weeks. So yeah. I think we are headed in the right direction. But as we said on Friday, we have to stay buckled down really tight for May, and then we can start to open up during June. And we're still on, if we do all that and plus vaccination, we're still on target for having a much less restrictive summer.
Well, before we get to vaccines, because we'll try to end with that, but let's talk about testing, because we went over the last few weeks where there's been a lot of testing going on. Maybe you can talk about how the lab's doing with it. I forget the number was of how many total tests they've done since last year, but it's been a phenomenal amount of work that they've done.
It's incredible. We've done more testing, I think, in the month of April than it was for the previous 9 months in the pandemic. And if folks may have heard me say, when back in January of 2000, we could do, or when we first started doing these tests, January, February, we could do 200 COVID tests a day. Now we can do up to 15,000 a day through that lab. And that's really because of, we've got more machines and more equipment, but a lot of it is the dedication and the innovative and problem solving approach that they've taken in the lab. They're not saying, well, we can't do it. They're saying they take it as a challenge. They, well, how are we going to allow us so we can do this? So kudos to them. And then we've also got the asymptomatic pop-up testing using all from the federal government, the rapid test kits that I think we're probably leading the country in how we use those kits in our kind of in an innovative way. And I think being a core part of our strategy is using lots of testing as a way to stay out front of the virus.
Yeah, no, we had the Slovak Republic at the health committee today, the federal health committee, and they were talking about their usage of rapid tests, and they actually deployed them a lot more than they did even the PCR, just to sort of, because of that lag time. So you get the PCR, you have to wait for the results, then you have to do the tracing. So sometimes communities or families seem to be, waiting a long time before they do it. They know that they have COVID, and they're out in the community doing things.
Yeah, and I think you got to use both, right? And so
Yeah.
we know that the rapid kits aren't as accurate. And one of the things that's always been that people have to understand, if they get using a rapid test kit at one of our pop-ups, a negative only means you're negative for today. It doesn't mean that
That's
tomorrow right. You may be incubating, and tomorrow you may be positive. But they certainly have a significant role, and I think they're part of why we've been able to do so well. And when we've had this last surge, or even back in before Christmas, we very rapidly used pop-up rapid testing to really get a handle on where we're at with the virus, and then use all our other tools to bring it under control quickly.
Yeah, and people have been very compliant, because I know even here where they've opened up a few times, Mariner Center, I think the old the Mariners on Main, they've actually had a few pop-ups, and they've been very well attended. People, they go get in line and they go get tested because they just want to know.
And I think that's kudos. I mean, I thank everybody who's done that. All Nova Scotia people have responded when we've said we really need people to get tested now, and people have responded, and it's part of, again, it's so encouraging to see how Nova Scotians continue to answer the call, if you will, that what do we need to do around COVID, keeping each other safe, and testing is part of that.
How about, so we move into isolation. So because you are identified as being COVID positive, family members, people that have been flying in, how many people are we actually helping with their isolation? I guess is probably the best, because we reach out to them every day. We do checkups with them. So how many people are actually isolating in the province right now?
We probably have, last week I got asked this, it was about 8,000. We know we've had a number of more cases, and people are isolating for periods of time. So we're probably, I'm just guessing here, we're probably in the range of 10,000 or so. It's a big chunk. So we shouldn't diminish that. We always talk about cases, but there's many, many more Nova Scotians who are very directly impacted by COVID as well. What has the province done? Sort of, I mean, I've traveled a couple of times in the last year. I've gone back and forth between Ottawa and here, spent my time, but I didn't necessarily get the phone calls, and those came later on. So, what kind of technology have you guys actually put in place to actually get a hold of that situation? Yeah, so we now have everybody coming into the province, and we just recently have tightened it down. So, for other than permanent residents coming back or business reasons, not much chance to get in right now. But everybody coming in has to do an online digital safe check-in form, which we got that in place probably, in the early fall. And with that digital check-in is a requirement for you then to on your phone, make some kind of connection back, whether it's a text or making a phone call to a virtual, and then we monitor that. And if we haven't heard from people, then we'll reach out to them to say, what's happening. You're still under quarantine, and then if they're after a certain period of time, if we haven't heard from people, then we know that they're meant to be under quarantine. We'll refer that to local law enforcement to make a visit.
Yeah. So, I mean, you mentioned boundaries for a minute. You mentioned borders. So that is a pretty tight lockup of the border. I think I sent you an email on the weekends from a family that was on their way in halfway between here and Alberta. They made it in by 1 a.m. last night. So they made it before the 8 o'clock. But, I think that probably will be, we'll hear a little more of this over the next few days, I'm guessing.
Yeah, and we said at the briefing today, Chris, that we realize we're put people in the hard spot with increasing the rules. So we have put in place. We haven't changed the rules, but we've put in place. So we have a COVID exemption email, sure. And all this is on our COVID website. That if people with the changing rules, or people in a really hard situation, send us an email, explain all your circumstances, and we'll have a look at that. We're trying to stay. We have to stay really firm, but at the same time, we don't want to put people in homeless without anywhere to live or so. So we have created this. I think of an appropriate balance, and we need to be compassionate and a way for people to ask for some I guess understanding of some unique circumstances that they may have.
Yeah, no, and I think that's probably the point where people have sold their house. They don't have a place to go back to. They were supposed to be on their way. I mean, you did, and the government did something that other jurisdictions weren't able to do. They kept COVID away for quite a long time. So we became a harbor for those folks that were trying to get out of the cities, get out of Ontario, get out of Quebec, get out of Alberta, and buy properties back here. So, I think we're reaping the benefit in a way of staying COVID free.
Yeah, it's just for this time, a short period of time, we got to get things back under control. And we are going to have to rely on, I think, those tighter border measures for a period of time until the rest of the country, kind of brings things slowly under control. I think we'll get there. The vaccine is going to start to show a substantive impact over the next month or two as we build much higher levels of, population immunity across the country. We will start to get this third wave under control nationally, but we're going to be ahead of Atlantic Canada is going to be at the forefront of that wave. So we're still going to have to remain cautious about the rest of Canada, maybe through the summer.
Okay, well, let's talk about one more rule that before we get into vaccines. So I've been getting a lot of phone calls today about people that travel. So this issue of community of interest versus municipality. So we got people from the Shelburne County, Barrington area that would travel to Yarmouth to do groceries or pick up certain things, and apparently there's a checkpoint in between the two right now. Can you give us an idea of how those are supposed to transpire and people stay as much in their community as possible? But what if they were traveling a little bit?
Yeah, so we are asking people to stay at home as much as they can, or as close to home, and do your essential traveling. We know people need to go get groceries. People have medical, legal, child custody, or even child care, work reasons. And rural Nova Scotia, sometimes you have to travel a fair ways. We're not trying to get in the way of that. Under the Emergency Measures Act, it basically says you have to stay within your municipal unit, but it lays out a number of those reasons, except for travel for certain reasons. So that's the legal piece. But again, and my, under the Health Protection Act, I'm just trying to have people, let's use our common sense, use our intelligence. And for the next month, it's, stay close to home, essential kind of, travel only. But, we do want people to get out and about in their local community, to be in their household groups, to go for a walk, to be physically active. You can visit your neighbor, go for a walk with your neighbor, as long as you're outdoors, 6 feet apart. We need to still have some kind of social connection, but not getting together in close contact, staying close to home, staying within your household is what we're, and we're already seeing the impact of that in a positive way.
Yeah, no, and the point I'm trying to make is just sometimes those lines are a little gray. They're not quite as municipality versus county. So, hopefully people can understand that, but they can go to work, they can go to doctor's appointments, they can go shopping for groceries and essentials, those kinds of things.
Absolutely. And I know that, yet again, in rural Nova Scotia, sometimes you may have to cross one of those boundaries because that's the closest grocery store. And I'm sure law enforcement is going to have that, this isn't really about enforcing people as much as reminding them. Some oversight, but hopefully the majority of people, just, know what to do and do the right thing.
Yeah.
And then we're taking a reasonable approach about it.
Yeah. And then other things like camping and that's going to have to come later on.
Yeah, camping, you travel, if you live in Yarmouth and you want to go to, your favorite fishing stream in Cape Breton, not right now. We just have, close to home.
So let's finish up with vaccines, because vaccines on mind of lots of people. We've been critical at the federal level at the slow rollout of vaccines across the country, but it's really starting to pick up there now. So now we're sort of getting into the issue of vaccine hesitancy and those kinds of things. I've got my vaccine booked for Wednesday at 12:45. So great. I'll grow my extra arm at that point. But let's talk about vaccination. How do you feel it's actually going?
So we know two things. We announced Friday we're opened up all the way down to the 45 to 49-year-olds with the mRNA vaccine. We've had the 40 to 65 for a few weeks with AstraZeneca. We've had really strong uptake in that latest age group, so much so that we maybe even earlier, as later in the week, we'll be able to open up to the 40 to 44-year-olds, because we are getting much more robust supply of all of the Pfizer and Moderna now coming to us. When we've looked at it last week, the age groups that have had enough time to get a good sense of their uptake, the 65 and above, they're all well over 80% or more. So we're getting really good uptake. The important thing, we tend to get lower uptake in younger age groups. So the important thing is we're going to have to sustain that high demand for vaccine as we get into younger and younger age groups. It's going to be really important. One more way that we need all Nova Scotians to kind of step up and do what they need to do to keep each other safe. And that is hopefully people understand that vaccination is how we control this latest wave, but it also sets us up on a longer term path of how do we, even if we get coming back again, hopefully with good vaccination, we never have to go through these tight lockdowns and restrictions again.
So as we roll around, so right now it's 45 plus. You hopefully can drop it down to 40 soon, 35, 30 as it goes down the pipe. What happens? Vaccination goes well. We started getting more vaccinations. Are we still going to maintain that 4-month interval, the 100-day interval, or could that change over time?
Well, we're looking at, we're with the vaccine supply, we're on target to get every eligible age group, and we're now the vaccine we can. It's been licensed. We can soon open up. When we get there to the 12 to 15-year-olds. With the Pfizer vaccine. We're even adding those in with the vaccine supply. We'll be able to get every eligible Nova Scotian the opportunity to get vaccinated by the end of June. We're going to then roll right into the second dose. We're not going to take a pause in our vaccine team. We're just going to keep going, because the first dose is really effective, but you need the second dose to build a long-lasting immunity. So the second dose, I think this is really important. The second dose is as important as the first dose. So but we're going to keep the full court press on with that, and so as we start in July, there will be people that we'll be able to start immunizing right away, and we'll be able to shorten down potentially that get closer to the 3-month period than the 4-month period.
And for those people that don't know how to do this yet, because there's a website, novascotia.ca. We go to the COVID section of it. We'll leave a link on the bottom of this call. But you go to vaccine, you can book your vaccine there. And a lot of times you get to pick what vaccine. If you're in that age group, you can pick the Pfizer or Moderna or AstraZeneca, maybe Janssen at some point.
And you can pick your location as well. I think we're seeing having a single central booking system is really turning out to be a success for Nova Scotia. Many other provinces are struggling in this area, and we're being recognized across the country of this central booking system, which ironically was done in partnership with an Ontario-based company. Yeah, no, and okay, well, and one question that actually came up about the actual distance between them, depending on what you have. Let's say you have MS or you have Crohn's. Sometimes those dates don't quite work for it. Is there going to be an adjustment for that? Maybe we're looking at that of what medical conditions may require that. Or the evidence of all that is pretty slim. We do know for some of our approach has been to focus really on age, and it's allowed us to move. It's been a very efficient process. Again, some other provinces have taken different approaches, which they've had many more kind of operational kind of challenges. So again, if our ultimate goal is to get everybody 2 doses as quickly as we can, we're going to looking at likely sticking with mostly an age-based process. But are there some medical conditions that may need different attention? But also people need to know, even if they have a medical condition, they may well, and they're concerned they're not going to respond as well to the vaccine. What protects them is getting lots and lots of people around them vaccinated. So the more, still following the fastest process to get everybody vaccine protects even those individuals who may have a higher need for a less robust immune system themselves. Yeah, no, and we talked to NACI a couple of times at Health Committee, and we did ask them a number of questions on mixing and matching as well, where, you get Pfizer one, get Moderna second, get Astra one, get Pfizer second.
Has that been thought about a little bit, or watching the information that's coming?
Yeah, I try. I see the co-chair now. See, Dr. Deeks is now here in Nova Scotia. He's my deputy chief MWH, and so talked to her this morning about that. They're expecting data on that by late May, and some recommendations probably in early June on that.
Okay. Well, let's leave it with one last thing. So, okay, we get our vaccinations. We get our second vaccinations. Hopefully by September, November, maybe things start to turn sort of normal. I think normal comes in a few weeks when this third wave tends to wane off a little bit. But regular normal. Will we have to get a booster shot going into the future? We've talked about that one a little too.
Yeah, we don't really know that what the long term is, but I think it may well be that we need to get, maybe not every year, but periodic boosters. We don't really know yet, and some of the other things we use, like more use of masking and things like that. We know that those kind of things actually prevent the spread of a whole bunch of viruses. We had absolutely zero cases of influenza this year in Nova Scotia, and very little in the country. So all those measures actually work. So not that we're going to have tight restrictions, but I think there is something about some of the things we use to control COVID, especially during the winter months. Better hand washing, maybe masking when we go in public places. We may want to hang on to those.
Yeah, no, I mean, hey, I'm normally a flu person, so I get my flu shot. I make sure I do every year, and haven't talked to one person. I mean, that it's incredible, that common sense approach of washing your hands, wearing a mask, just doing those things that we would call common sense has gone a long ways as well.
Yeah. So.
Well, listen, I won't hold you up much longer. I know you've had a busy day already, and you probably don't finish until your 11 o'clock rolls around. So I just wanted to thank you. And if people have any questions, they can of course go on the website. We'll provide all that information as well. But I do appreciate you coming on today.
Well, thanks for the opportunity, Chris. The more I can talk to Nova Scotians, give them good information, that's all part of my job. And let me just say thank you to all your constituents. Every part of Nova Scotia should be proud of how all our communities have rallied around. And really, I think it's so humbling to be part of this province that we've put so much of an emphasis on keeping each other safe and putting our community ahead of ourselves. And we should all be really proud of that.
Yeah. And again, maybe going back to where we started, reach out to a friend, reach out to an elderly person that, might be living alone. Those kinds of things go a long way to make sure that our neighbors are doing well. And if they need the help, then of course they can get it. So Dr. Strang, thank you so much for joining us on the website, on the Checkup, and good luck. We'll maybe talk to you in a couple of months when this is a little less of a third wave.
That'd be great. Thanks. Have a good night.
Okay. Thanks, Rob.
Bye-bye.